Okay, everybody, our first recorded lecture, Med Legal and Ethical Issues. This is chapter 3 out of your textbook. I'm going to tell you guys right now that if you guys do pay attention to this lecture that I'm recording for you now, you guys will do very well on this part of the exam that's coming up for you guys. There is a lot of vocab words in here that you guys will need to know. And make sure that you guys, if you have any questions, you either bring them up in class, email me, or make sure that you guys are also referring to your textbook as well to help you clarify and solidify the information. This PowerPoint is located on your Brightspace page. I will not be going through the exact PowerPoint that you guys have. This is kind of more of a focus lecture for you guys. I'm also going to kind of break this down into different types of categories so you guys are not getting one big lecture. You guys will get about 20-minute lectures. This is going to be true for all the lectures this semester. So we'll get started on this next slide here. Okay, so EMS in general, we are here to do a couple things. We're here to benefit the outcomes of our patient. We are here to, you guys have heard this, the famous saying, to do no harm, right? The great oath of medicine, do no harm. We want to do what we can for our patients during their time of need. There's going to be a lot of other stuff that comes into play that we're going to talk about as well during this lecture, but the first one we want to talk about is consent. Consent is very important to be able to make sure that we get consent from our patients, okay? Consent is permission for us to render care for a patient. Now, just because we were called for 911 to respond to a patient doesn't necessarily mean that they are giving us consent to render aid to them, okay? You guys still need to introduce yourselves to your patient. You guys need to ask your patient if you can take vital signs on them. You have to ask your patient if you are able to touch them in the first place. Okay, a person must give you consent for treatment. Period. They must give you consent. There is no ifs, ands, or buts about it. Now, some of you guys are saying, "Well, what if they're unresponsive?" Well, or what if they are unconscious? Or what if they are altered? What if there's possibility of drugs, illegal or prescription drugs on board or something like that, right? We're going to get to that. We're going to get to that in this lecture as well. But if a person is rational and conscious. So let's talk about this for a little bit. What does that mean? What does it mean for somebody to be rational and conscious? Well, in EMS specifically, what we look for is my patient tracking me, right? Are they following me with their eyes? That's what tracking means. Are they following me with their eyes? Do they look like they comprehend what I'm asking them, right? Are they able to tell me their name? Are they able to tell me where they're at? Are they able to tell me what day of the week it is or what holiday is coming up? Or what we call alert and oriented to person, place, time, and event. Okay? If that patient is alert and oriented to person, place, time, and event, they have the right to refuse treatment. Now, there's going to be some caveats to that also coming up. Okay? But for now, for consent, okay, if they are alert to person, place, time, and event, they can refuse treatment. Period. Okay? You can walk in on somebody. You guys can see this person having a heart attack, right? You guys know this person's having a heart attack because you recognize the signs and symptoms having a heart attack. If this patient does not want you to render aid, and they are alert and oriented to person, place, time, and event, they have every right to refuse care. Okay? Now, you can explain to them all you want that, look, sir or ma'am, you could pass away. You could die. If I don't render aid, if we don't get you to the hospital, your outcome could be very poor, right? And as long as they understand that, okay, and they are alert to person, place, time, and event, they have every right to refuse care. Okay? We're going to talk about that a little bit more also coming up. When we're talking about consent for a patient and we're asking for permission for us to render aid to our patient, again, we're looking to make sure that our patient is conscious and alert and oriented to person, place, time, and event, that they have the mentation in order to understand the words that are coming out of our mouths, and to be able to comprehend those words coming out of our mouths. And we also want to make sure that they're not altered by any other means, such as drug use or alcohol abuse or possible other medical conditions that can cause altermentation, which we'll get to later on this semester. But they do have the rights to refuse and make decisions about their own health. Okay, if they're alert and oriented to person, place, time, and events, and we have given them that informed discussion that, look, you could die if we don't do anything for you, and they understand that, then they have every single right to refuse care. Okay, so as we are moving into consent, there's a few different consents that we need to understand as EMS. The first one is express consent. This is where the patient actually acknowledges that they want you to provide them care. Okay, this could be just a head nod of yes. Okay, this could be them actually saying yes. This could be them giving you the thumbs up. Okay, this could be them of some kind of express consent. They could give you the middle finger, right, to say that they don't want care. They can shake their head no. Any kind of expression is express consent. Okay. In order for this to be valid, okay, you must get what we call informed consent, which is what we're going to talk about in our next slide, all right? Which, again, with that informed consent is you have explained to the patient the treatments that are going to happen to this patient, the risks and or benefits of these treatments to this patient, and what could happen to this patient if they do not receive your care. All right, so we've kind of talked express consent. We've kind of talked on how you're going to inform the patient, or informed consent, on how you're going to explain the procedures and treatments and what could happen to that patient if they don't receive those treatments. Okay, now we're going to get into implied consent. Basically, implied consent is going to be for any patient that is unconscious or unresponsive, or they are incapable of making some form of informed decision. Okay, these are the people that they might be on that mind-altering substance. They might be intoxicated on alcohol. They might be on some kind of mind-altering drug. Okay, they could have some kind of medical condition to where they might not be able to understand things in the first place like we would as the quote-unquote normal adults. Okay, this could also be for children, right? Children under 18. We need to get consent from parents, all right? And we're going to talk about that here in a little bit. I don't want to get too far into that now. But if their parents are not there on scene with them, or we are unable to get a hold of that child's parents, we can utilize implied consent for our patients. When we're talking about implied consent, these are for the patients, again, that are unresponsive or on some kind of mind-altering substance, or may have some kind of medical condition where they don't have that ability to comprehend in the first place. There are some caveats to this as well. So implied consent should only be applied if there is a threat to life or limb. Okay? This is also known as what we call the emergency doctrine. Okay? We are going to imply that if this patient was alert and oriented to person, place, time, and event, okay, or what we call alert and oriented times 4 in EMS, that if they were capable of making this informed decision because they are unresponsive, or because they are unconscious, or because they are on some kind of mind-altering device, or mind-altering substance, that they would want our help, okay? Because this patient's unresponsive, if this patient was alert and oriented, I can imply that this patient would want my help. That's known as the emergency doctrine, okay? If possible, and that patient is unresponsive, right, or that patient is on some kind of mind-altering substance, let's ask family members. Let's ask a friend, right? Somebody that might be on scene with that patient. Somebody that can answer, like, is this patient usually like this, right? Is this the patient's normal mentation, right? And we can get consent from a spouse or some kind of some relative to the patient, okay? And then we need to document all this, okay? And you guys will get another lecture on documentation, but we want to write down everything. Basically, what we're trying to do is CYA. I mean, let's be honest here. CYA, right? That means we are trying to cover our ass, cover your ass, okay? If you do not write it down in your chart, it did not happen. Period. Okay? And we're going to talk about charting, like I said, later on in another lecture. But if you guys do not write it down in your chart, if it is not documented, it did not happen. Period. Okay? We'll talk about that here in a little bit. So involuntary consent is kind of a tricky subject in EMS. It really kind of depends on the service, the standard operating procedures and the protocols based on where you are working. Most of the services, if you're in the same area, such as the Bernalillo County EMS system, we are all on the same page on this, okay? But when you go outside of the Bernalillo County EMS system, and we go into a different county, they might have a whole new set of protocols on what they can do for involuntary consent. Okay, and we're going to talk about that a little bit more later on this semester. But basically, involuntary consent is going to apply to any patient that might be mentally ill or in a behavioral crisis. Okay, so what does it mean to be mentally ill? What does it mean to be in a behavioral crisis? Okay, well, again, we're going to talk about that later on this semester, but this can also be basically outlined by your service that you guys enter, okay? Mentally ill could be somebody that is a known schizophrenic. They might be depressed. They might be manic. They might be bipolar, okay? Somebody that has a known mental illness, okay, that's been documented, or might just have an acute sudden onset of something, right? We all have our bad days, right? I mean, we're all human, right? We all have our bad days. Somebody that could be stressed out can technically be considered mentally ill, all right? A behavioral crisis. Behavioral crises could be somebody that might be or feeling suicidal, and they have expressed that they are thinking about committing suicide, or they've had suicidal thoughts, or what we call suicidal ideations in EMS, okay? They might have a plan. They might have what we call a means and a method, right? They might have the means to commit suicide. Maybe something happened in their life, right? Maybe they lost a loved one. Maybe they just got out of a wicked divorce or something like that, or they lost access to their kids. Who knows, okay? Something that has set this patient off, and they have stated that they have a means, right, a reason to commit suicide, and then a method, right? I'm going to blow my brains out. I'm going to jump in front of a bus. I'm going to hang myself, right? Something like that, okay? The other people that we can do an involuntary consent on is somebody that is developmentally delayed, okay? Somebody with like a mental retardation or a mental handicap, all right? This could also include children, okay? Remember that involuntary consent is kind of going into that implied consent as well when we're talking about children. You might have that 15-year-old that says, hey, there's nothing wrong with me. I'm not going with you guys. Well, you can now do involuntary consent because they're not adults. They have to be 18 years or older in order to make an informed decision per the law, okay? So they might say, no, I don't want to go. But mom says, nope, they're going to the hospital. Absolutely, you're going to take them to the hospital if you're able to get a hold of her or dad or whoever, right? That can be an involuntary consent also, okay? The big thing is that we want to obtain consent from the guardian of the patient, the legal guardian or the parent of the patient, whenever possible. Okay, it's not always possible. All right. So because it's not always possible, you guys will fall back on your local guidelines, whatever jurisdiction or whatever department their standing operating procedures tells you how you should handle this situation if you come into it. Okay, diving a little further into minors and consent. So, when we're talking about minors, we're talking about anybody that is under the age of 18. Okay, anybody under the age of 18, we must get their parent or legal guardian to give us consent. Okay, now we've already talked about this before. If we are not able to get a hold of the parents of that person, then we can do what is now known as what type of consent? Implied consent. Okay, we can imply or assume that if mom and dad or legal guardian was there with this patient, they would want this patient transported to the hospital and treated in order to help that patient in their time of need. Okay. When we're talking about minors and consent, most of the time when this comes into play is obviously during the school years and the child is at school and maybe they fell down and bumped their head on the playground during lunch. Okay. And the school calls us to come and evaluate the child, and we go to the nurse's office, and hopefully the nurse's office has all the information we need for the child, and hopefully the nurse's office has already attempted to or has initiated contact with the patient's parents or legal guardian in order for us to get consent. Now, if they haven't done that, or we try to call as EMS and we're not able to get a hold of the parents, well, then we can go under implied consent at that point and transport that patient to the hospital in order for that patient to be treated. Okay. In some states, a minor can actually give consent. It depends on the age and maturity of that child. Okay. New Mexico is not one of those states. Okay. We do have emancipated minors, though. All right. Emancipated minors could be somebody that has been legally granted to be emancipated from their parents. I don't know if you guys know who Macaulay Culkin is. It's the little kid from Home Alone. He was actually emancipated from his parents. He was able to prove to the court that he was able to provide food, water, shelter, and had the monetary needs in order to care for himself. Okay? So he was actually an emancipated minor, and I think he did that at I want to say 10 or 11 years old. He was able to emancipate from his parents, and you have to go in front of the judge. Okay, armed services will actually you can become an emancipated minor because you are in the armed services. And marriage, there are some states, and New Mexico is one of them, that can force you to get married. Okay, that can force a child to get married to maybe somebody that they got pregnant. Okay, the courts can order that. All right, if they are married, they are technically at that point emancipated. Here's the interesting thing. Okay, is you can have a minor. Let's say we have a 16-year-old female, right, who has a 2-year-old child already. Okay. And that is very common out here in New Mexico. All right. The 16-year-old can make decisions about her 2-year-old child, but she cannot make decisions on her own personal health care. We have got to call the parent or legal guardian because she is under the age of 18 in order to find out what to do with her. But she can make decisions on her child because she is the parent or legal guardian. Kind of weird, right? And we're going to talk about that a little bit more later on this semester as well. Here in the States, we have something called local parentis. Okay, this is somebody that can act as the legal guardian or parent of the child if they volunteer to do so. Okay, those are the key words. If they volunteer to do so. Okay, so we can use this in EMS specifically with teachers or school officials. They can act in place as the child's parents. Okay, I'm going to tell you right now, it is very, very rare to see this. Okay, the amount of legal responsibility that comes on a teacher or a school official that starts acting as the child's parents is through the roof, right? And the lawsuits that can come out of this are unreal. What do you have to do during all this? Document, document, document. Okay? If you are unable to get a hold of that 16-year-old girl's parents, we were unable to get a hold of parents. We pulled implied consent, however you guys want to say it. We acted in implied consent, right? However you guys want to put it in your chart, but you will document it. Okay? You must document what is going on. If there's a teacher or a school official that jumps in to act as the parents of that patient, we need their name. Okay, probably need their date of birth, but these are stuff that you guys are going to get training on once you guys get into your services. Okay, so when we're dealing with minors and consent again, if a true emergency does exist, okay, and we are not able to get consent from the parent or legal guardian, or nobody wants to act in lieu of the parents or legal guardians, such as that local parentis, right? We can treat the patient under implied consent. But remember that there's caveats to implied consent as well. And the big caveat to implied consent is that we have a threat to life or limb. Okay? So we can treat that minor. All right? We can treat that minor without contacting their parents or legal guardians using implied consent if there is a threat to life and limb. If there's no threat to life and limb, right, we probably don't need to be treating this child in the first place. But if there's a threat to life and limb, we can treat the patient under implied consent without getting hold of the patient's legal guardian. That's going to finish up the consent portion of this lecture, and we're going to jump into the next portion, which is going to be forcible restraint and a couple other subjects as well.